What happens when we eat too much sugar? In the course of a normal day, our blood sugar levels will increase after we eat and then start to decrease, but this range should be pretty consistent. If we eat too much sugar, our blood sugar level will spike in response. If it starts happening too often, those overall levels will just stay chronically high. When sugar is in the bloodstream, it's grabbing onto proteins and red blood cells, a process called glycation. This process is normal, our body can deal with that. But with too many glycated proteins running around, our body can't control those negative effects anymore. These protein-sugar complexes are rather large, and they're a little bit sticky and a little bit spiky. The more these glycated proteins bump into the inside walls of the blood vessels, the more damage that occurs. So right away, when we eat too much sugar, we're going to increase systemic inflammation. That inflammation is occurring because we're trying to repair the damage in those blood vessels. But the damaged blood vessels themselves are a bigger problem, particularly at the really small blood vessels in our heart, kidney, brain, eyes, fingers, toes, penis. And chronically elevated blood sugar levels are tied to Alzheimer's, dementia, kidney failure, heart attacks, erectile dysfunction, slow wound healing, particularly in the feet, which could lead to infections and amputations. And while those are extreme examples, more subtle blood sugar issues can lead to more subtle issues. Fatigue, depression, anxiety, issues in cognitive function, focus, attention, memory. And if this is something that doesn't concern you at all, I want you to consider the fact that more than 1 in 3 Americans is pre-diabetic. And these more subtle issues that we were just discussing can occur at levels even lower than would be considered pre-diabetic. This is definitely something to take seriously.